We begin with the extreme caution across this country tonight. Doctors and emergency rooms on the lookout for Ebola. Tonight we have learned one person being tested here in New York City after having traveled to the region. That patient in isolation after being tested at Mount Sinai Hospital here in New York City. And the CDC telling our Dr. Besser tonight that since the outbreak began, about a half dozen patients have been tested right here in America. There is also news tonight about the experimental drug used to treat that American doctor infected, now back here in the U.S. He is showing signs of improvement, communicating with his wife through a glass window. The doctor surprising everyone when we saw him walk out of the ambulance and into that hospital. Dr. Besser is standing by with what he's learned, but first, ABC's Steve Osunsami in Atlanta, leading us off.
While physicians in Atlanta fight to save the life of Dr. Kent Brantley, administrators at Mount Sinai Hospital in New York sharing quite a scare today. A patient they worried might be sick with Ebola. He's isolated tonight after walking into the emergency room with a fever and gastrointestinal symptoms. He had recently traveled to a West African country struggling with the outbreak.
We'll be able to hopefully find that there is a more common cause of fever and other symptoms that the patient has, but using an abundance of caution, we're going to work carefully with the CDC to make certain that this patient does not have the Ebola virus disease.
Only 40% of Ebola patients survive, and the Atlanta doctors treating Brantley are hopeful he'll be one of them. He arrived stateside on Saturday, climbing down from this ambulance in a full biosuit and walked into Emory University Hospital. He's been taking an experimental drug that his missionary organization tells us is working wonders after he was on the brink of death. Today, we've learned his fever is lower. The 33-year-old doctor from Tennessee had just moved his family to Liberia. His aid organization tells us he and others at his field hospital were infected by someone who was sick on their cleaning crew. Nancy Wrightbull from Charlotte helped decontaminate doctors, and she's seen here. She got sick too. She's on a flight to Atlanta tonight in the same specially outfitted transport that moved Dr. Brantley. She too received a dose of the experimental drug, and her condition is improving.
Nancy is able to walk around. There's some signs of strengthening.
We saw the ambulance that will drive her to the hospital scoured down by paramedics after moving Brantley Saturday. The bleach that I'm smelling is because we're dealing with Ebola. Correct. After Wrightbull is hospitalized, they'll throw away or burn protective covers and blankets used inside.
All the drapes and barriers that we put in there would be discarded and burned. Burned? Absolutely. Now it would be incinerated.
The disease has already killed almost 900 people in 3 African countries. A sick person flew from Liberia to Nigeria, and now the doctor who treated him is also sick. Tonight, Dr. Brantley's wife is here with him in Atlanta, but she cannot hold her husband's hand. She has to speak with him through a phone and through a thin glass. David?
Steve Osunsami leading us off tonight. Steve, thank you. I want to bring in Dr. Rich Besser because, Rich, you were telling me you talked to the CDC late today. They revealed they've tested at least a half dozen patients around the country for Ebola so far. All of these patients had traveled to that hot zone?
They'd all traveled there. They had symptoms that were consistent with Ebola, and so they were tested and isolated. That's exactly what you want to see happen.
And so far, these tests have been negative. We're still waiting on the one here in New York City.
That's right.
In the meantime, I want to turn to viewer questions. There have been so many tweets. One viewer tweeting me today, what was in the experimental serum that drug given to the Ebola patient, the doctor who's now come back to America?
So that drug contains 3 factors that go right after Ebola. It's never been tested in humans. I'd urge some caution. I mean, it's so encouraging he's getting better, but we don't know that it's because of that drug.
It's still encouraging to see him walk out of that ambulance. Another question, and this was a very common one, is there any reasonable way to prevent transmission around the world given international travel? This is a real concern, Rich.
Yeah, I mean, because you can have this virus in your blood without showing any signs for weeks, we are going to see isolated cases pop up. If we're vigilant like they are in New York right now, we're not going to see it spread. To totally knock it out, we have to get together as a world and knock it out in West Africa.
All right, Dr. Besser with us every step of the way.